So, what's your name?
Malika Lewis.
Okay, where are you?
I'm at my cousin's house.
Okay, what's your purpose?
I need to get a checkup today.
Okay, what time is estimated about to be?
About 5 or 6.
Okay, okay. Well, you seem to be oriented because you got 4 out of 4 right. Also, you're brown. You seem coherent. Your speech is clear. So, that's good, okay? So, let's get started.
Okay.
Okay. Your scalp seems to be clear from dandruff. Let me check your cranium.
Okay.
Your cranium appears to be firm. And your facial expression, it seems to be matching your verbalization. So that's good, okay? And your mandibular joint, I'll open your mouth and close. Okay, that's good. It moves smoothly. All right, I'm gonna check your. Can you move your glasses for 1 second?
Okay.
I'm gonna check your maxillary
Okay.
sinus. You feeling the type of if it's any pressure or something right there? Does that hurt?
No.
Okay. Your phone.
No, ma'am.
Okay. All right. Your eyes. Okay, I'm gonna check them out. All right. Your conjunctiva seems to be nice and pink. Okay. The sclera seems to be white. Your pupils are round and brown. Okay. All right. So, let me check you for Perla.
Okay.
All right. All right. So the pupils, they are round. They are equal. Okay. Let me see. All right. They are accommodating. Okay. So they're Perla. You can put your glasses back on. I see that you wear glasses, so I know that your sight is corrected. But if I wanted to do a distance vision acuity on you, I would use a Snellen chart held at 20 feet away, ask you to read and see how much less you could do. If I wanted to check your near vision, I would also use a Jagger chart and ask you to read and see what the small letters that you can read. Okay. Moving to your nose. All right. Looking at your ear, external ear. Okay. They seem to be symmetrical, and they seem to be 4 centimeters. They have no discharge and free edema or any type of discharge. So they are good. Okay. If I had a optoscope, then I would check your tematic membrane to make sure if it was pearly gray as it's supposed to be. I don't have one though. Okay. Also the proper test I would use is a Weber test. It uses a tuning fork to test for vibration. To see if the client can hear the vibrations equally. And I will place it right here on top of your head. Okay. The RAN test uses the tuning fork as well, but I would vibrate it and I would set it to the back of your ears and see if the bone, but by comparing conventional sound against conduction of bone, conduction of sound vibrations. Okay, I'm gonna do the whisper test on you and see if you can hear. You say your, see can you hear what I say behind your back.
Dog.
Okay, yes. All right. All right, we're gonna move along to inspecting your neck. Okay. Your neck seems to be the same color as your face. It's free of any type of lumps. I'm gonna palpate it. Okay, I'm gonna palpate the cervical nodes. Okay, everything feel good. All right, I'm gonna palpate the pre-ocular nodes, the post-ocular nodes, and then mandibular, submental node, and then I'm gonna palpate your carotid post, one at a time, because if I do both, I could I could make you pass out. Okay. Also, now I'm going to check your trachea for deviation. Okay. Now I'm going to palpate your thyroid gland. Okay, for the JVD, I would have you lay at a 30 to 45 degree, and I would check to see if I can see your pulsation of that vein, but I don't want to see that vein in your neck. But since we don't have, proper bedding and stuff to elevate you, we can't conduct that. Okay, I'm gonna check your range of motion and cervical strength. Look to your left, look to your right. Now, look to your right, just push my hand if you can, okay? Look to your left, push my hand, okay? Look down, okay? Look up. All right, so it seems that your range of motion for this area is good. Okay, I'm gonna inspect your interior chest. Okay, everything seems to be even. You don't use accessory muscles to breathe. Your breathing seems to be even and without any type of effort, so that's good. Okay, I'm gonna auscultate your interior breath sounds. When I put this on these sites, you just take deep breaths, okay? It's 8 on front. All right. I check all 8 breath sounds on front. Okay. Okay, I'm gonna check your orbital pulse and see what your pulse is. Can I see your phone for time? Set it at 1 minute.
Start now.
I'm sorry. I'm gonna start back again with it. So right spot. 74 beats per minute. So that's normal because anything between 60 and 100 is normal. Okay. Now I'm going to auscultate these sites. This is the aortic area. This is pulmonic area. This is Erd point. The tricuspid area and the mitral area. Okay. Okay, now I gotta auscultate your posterior chest. You wanna just turn around for me? Okay. Just take deep breaths as I do this. This is 10 points on her back. You ready?
Mm-hmm.
Deep breath. All right. Sounds good and clear. It sounds good and clear. Abnormal lungs would be wheezing, crackles, and stridor. Wheezing, bronchioles, stridor, and stratum. That's it. Okay. Okay. I'm not going to inspect your breast, but I'm going to verbalize it. If I was checking the breast, I would check all quadrants of it, the areola, the nipple, the breasts themselves, and the axilla on both sides. And I would do this so laterally for both to check for lumps and, abnormalities. Also, do you do breast exams monthly?
No.
Oh, it's very important that you do so you can identify any abnormalities in your breast. Okay. Upper extremities. Okay. I'm gonna inspect your hands and your arms. The color is nice and even. The temperature is consistent. Your turgor, just a little paint on you. Check your turgor. It's good. Your nails are nice and pink. Okay. There's no clubbing. Your capillary refill is less than 3 seconds. That's good. Okay, I'm going to palpate your radial pulse, which is here. Okay, you have a nice bounding pulse for that, for your radial pulse and your brachial pulse. Okay. Okay. All right, got your brachial pulse. Now I'm going to the range of motion for your hands. Okay, take your hands and just do them supine implement. And okay, so your range of motion is good for your hands. Okay, and your shoulders, can you, move them around. Okay, you got good range of motion. Can you roll them? No. Can you do your arms out to the side? Rotate them? Okay, you got good range of motion. Okay. Okay, now I'm gonna hold my hands here and press down lightly. I want you to see if you can raise your shoulders up a little bit. Good. Okay. All right, do it again. All right, that's good. Okay. Okay. I'm gonna check your grips now. Take my hand and squeeze as hard as you can. Ow. Yeah. It worked. You got good grip. Okay. We're gonna move down to your abdomen. I'm gonna need you to lay down. How we gonna do this right quick? Hold up, 1 second. Move that one over. There you go. Alright. Camera person, you can walk over. You can lay down right here, Bree. Okay. I'm going to inspect your I'm going to inspect the abdomen. Okay. Let me inspect first everything. Breathing is normal. Okay. Now I'm going to listen to it before I palpate so I can get accurate bowel sounds for you. Okay. This is the right upper quadrant. This is the right left quadrant. This is the left lower quadrant. And this is the left upper quadrant. Okay. I hear your bowel sounds, and your bowel sounds came in around this area here, and it was your left upper quadrant, and it was so I say about 10 seconds. So it's normal. And I'm gonna palpate right quick, okay? So to palpate, I'm gonna just check it out. You have any does it hurt anywhere?
Nope.
Okay. Alright. Alright. Okay, we're gonna move on to the okay. So now we're moving along to your lower extremity. Okay, the color of your legs are consistent with the rest of your body. They're smooth. There's no edema. The temperature is warm, like throughout the rest of your body. Okay. If I want to palpate your femoral pulsite, I'll have to go in towards your groin area. But I'm not gonna do that. I'm just gonna verbalize that. But I will palpate your posterior papillita, and it's right here. Okay. Okay. The dorsal pedis. It's right here. All right. The homicide is not required for you because I see that you don't have any deep vein thrombosis. People who does have those, the homicide is contradicting them to do. Capillary refill of your toes. Can I get one of your feet out, please? Okay. It refill. Oh yeah, let me check your posterior, because I had forgot to do that while I'm down here. Okay, that's your posterior post right there, the dorsal. Got that. Okay. Range of motion. Can you do your feet? Okay, I'm gonna pick this up, and then I want you to bend it back in towards yourself. All right. All right. How about for resistance? Can you push my hand? All right. All right, let's do the other one. Okay, can you push my hand? All right. Knees, can you take your legs and rotate it around? Like, yeah, like that. Okay. You got good range of motion in your knees. Okay. Can you stand? Can you stand up and can you do your hips? Check for range of motion. Okay. Yeah. Okay. All right. Okay. And we're gonna check the strength resistance in your leg and feet one more time. So sit right there for a minute. Now kick. I'm gonna try to hold your feet down and you just kick it up, like try to lift it up as I'm holding it down. Okay? Alright. Go ahead. There you go. Alright. Alright. We're gonna move on. Alright. Okay. Alright. I'm gonna let you do heel to toe walk. So I want you to do just like this and walk all the way up. Okay. Now you can turn around. I want you to walk on your toes only. Just tiptoe. All right. Can you walk on your heel only? All right. Okay. All right. All right. You sit there down for a minute. Oh, you can stand up for one second. I'm sorry. Okay. I'm gonna check your spine. Bend down and touch your toes. All right, your range of motion for your spine. Can you try to do it like a bend and see? Can you bend? All right, stand up and just do like a twist around. Any pain or something when you doing spine twist?
No, ma'am.
Okay. All right. You can sit. Okay, we're gonna do the rumba right quick. Put your feet together. Okay. For the rumba, you put your feet together. Now, close your eyes. Okay. Now, can you sit still? Yep, you're good. All right. All right, you got your eyes up. Okay. Take your finger, stick it out, look first. Close your eyes, touch your nose. Do that twice. Okay, that's good. Okay.
Hey, go get him, man.
Now we're gonna do the Babinski reflex. Okay. And that consists of the toe. Okay. Yep, they spread out. Okay. All right. Deep 10 minute reflex. We're gonna do your biceps. This is your biceps now. Okay, just make a muscle. Yep, just like that. Okay. All right. Tricep. I want you to extend out for your tricep chicken. Okay. Biceps, tricep, and what else? I would also test your Achilles, which is at the heel of your feet, the ankle, and also I would check the patellar underneath that tendon with a rubber hammer, but I don't have one, so that concludes that. But we're gonna test the sensation in your hands and arms and fingers. Can you feel that?
Yes.
Can you feel it?
Yes.
It tickles.
Yes.
Okay. How about your arm?
Yes.
And that concludes our head toe assessment, guys.